So today we are having our 9th video on the COVID update. I am here to give you all the information that we have and bring the community and our employees up to date on where we are in this process. I do want to start by thanking our staff for you guys coming in each and every day, making differences in people's lives. It is so appreciated. We know how hard it is. We know how taxing it is on you, and our community and the people in this hospital and our board cannot thank you enough. We are continuing to see an increase in our COVID positive patients, as everyone is well aware. Today, we are at 118 patients in the hospital with that are COVID positive, and we have 26 in our ICU. We are monitoring all of our resources on a day-to-day basis, and quite candidly, probably more hour-to-hour basis. We have enough PPE. We really aren't in a shortage on PPE right now, so our personal protection equipment is secure, and we have enough to be able to operate. We do, however, have some issues around some of the treatment protocols or drugs. So remdesivir, we're currently out of, and we're waiting for another shipment right now. We're also out of convalescent plasma. We would encourage anyone who has had the disease and has the antibodies and is able to give plasma to reach out to the blood bank and go donate your plasma. So we're working on capacity each and every day. We're getting very innovative with how we move patients around the organization, always in mindful keeping our patients and our staff safe. I can tell you that is an ongoing process every day that nursing and other disciplines are getting together. I'm involved in that process as well as the medical staff. What is going on today probably is going to be different 2 days from now because we have such a dynamic situation right now. But we are making sure that we're open and available for this community, that we can take care of you if you're sick, and we're here to do that. While we're looking at a surge right now, one of the difficult things that we're going to have to deal with again is elective cases or non-emergent operating room cases. So we are meeting with the medical staff to determine how do we continue to do cases as much as we possibly can. We know that we're probably going to have to start limiting the number of cases that we do here, and we're working very closely with the chief of surgery, with the chief of staff, and the nursing units to make sure we can accommodate that. It's very reasonable to expect that we're going to have a decrease in non-emergent cases in the very near future. You know, surge capacity is not just trying to make sure we have enough beds for people to come into or patients to come into, and it's not just about having enough supplies available. It's about having the right personnel available too. We know that we are being challenged right now to make sure we staff adequately all of our units the way that we're used to doing. I will tell you that we are talking to temporary agencies and other areas around the country that can augment our staff here. As more develops in that, we'll certainly be sharing that with the organization. Ever since this pandemic started, we have made an extra effort to make sure our employees are safe each and every day in this organization. We continue to monitor the CDC guidelines, and we continue to make changes in those procedures and those ways that we protect our patients, both from the CDC guidelines, from our own medical staff feedback, but certainly from our staff feedback and what's important to them. So with the increase of COVID in our community, our employees are certainly not immune to catching that disease through community spread. We just want to make sure our employees, and as well as everyone else, stay safe and vigilant. We've had an increase of 48 of our employees test positive with COVID since July 4th. We just want to make sure that everybody's staying safe. Now, we have a lot of employees here. We have over 7,000 employees. It's still a small percentage, but we want everybody to stay safe each and every day. So we still have a no visitor policy in effect. I don't think that's going to change for quite some time going forward. We just want to keep COVID out of the hospital as much as possible. We are encouraging staff, if you don't feel good, don't come in, stay at home. Call the employee health hotline and talk with them about what you should do next. Please wear a mask. We cannot say it and stress it enough. Masks are important. Masks cut down the transmission of this disease. And when you are in the hospital, you certainly are required to wear a mask. but we encourage you when you're in the community to continue to wear a mask, be a role model for this community and for whoever you're around, and take it with you. You know, as the CDC guidelines continue to change and our recommendations from our clinical staff, medical physicians, and our nurses change, we're continuing to change what our rules are. So in addition to masks now, we are requiring our staff to wear face shields or goggles. This is simply to make sure that we keep everyone as safe as we possibly can. So we know this is a marathon, and it's not just a marathon, it's a very long marathon. We know people are going to get burned out. We know people are burning out right now. We want to make sure our employees know that there are resources here to help you cope with this, to help you to be able to manage through this process, and we want you to take advantage of those. We have a team focusing on initiatives to help people deal with what's going on right now and to get through this marathon. One of those right now that we've been doing is taking up snacks and Cokes and that type of thing to our COVID teams. We're going to expand that. We know everyone is working extraordinarily hard, and we're going to have more offerings coming up in the near future. If you are having issues, I would encourage you to call EAP. That's why they're there. They're there to help you. They're to help to talk with you and to get you through any kind of issues that you may personally be having. In the leadership team, I can tell you that we are talking about the burnout issue more than we're talking about just about anything else at this point. We're very concerned about it. We're very concerned about the emotional stability of our employees and their ability to keep doing what they do and keep providing for this community. So please let us know what we can do to help with that. The biggest thing the community can do is to wear a mask and to practice safe distancing, wash your hands. We've got to get a hold of this disease and make sure we can contain and reduce the spread of this throughout the community. The other thing the community can do is when you see a healthcare worker or a first responder, from a safe distance, just thank them for what they do. It means more than you can imagine to that person. So Sarasota Memorial has been a leader in research around this during this pandemic and around the COVID-19 disease. We were we're the only hospital in the state of Florida that was a trial for remdesivir, which is now widely being used to treat COVID patients. We are also a very big part of the convalescent plasma treatment that's now being widely used as well. We're also happy to announce that SMH is now in clinical trials for a new antibody cocktail that has very promising effects for COVID patients. We were the first in Florida to be able to partner with the drug company to do this, and we're, I think, one of 3 now that are in active studies. I do want to thank our clinical research teams. Tamila Fonseca is heading that up, along with Dr. Jim Fiorica, Dr. Kirk Volker, Dr. Manny Gordillo. They have really come together and have put us in a position to participate in these studies. It's very rare for a community hospital our size to be able to pull something like this off, and it's because of the dedication of that team that's making it happen. I want to wrap up our video today by just thanking the community for everything that you have done, to continue to encourage you to wear masks and practice safe distancing, to thank all of our employees, our medical staff, for everything that you do, for coming in and really lifting us all up each and every day. We're going to get through this. I'm not sure when this is going to end, like no one does, but we're going to be here, and we're going to be here to respond to the community each and every day.